Okay friends, so welcome back. So today we will going to discuss about multiple drug resistance. So as its name suggests, multiple drug resistance. Okay, that means in that particular cases or so it is clear that multiple drug resistance means it is a situation which is acquired by microorganism, right? So the microorganisms who have acquired multiple drug resistance have the ability to resist more than one drug, right? That is what the heading wants to tell us, right? So multiple drug resistance, also known as multi drug resistance, or sometimes also known as multi resistance, is nothing but a property or is nothing but antimicrobial resistance, okay, that is shown by a particular bacterial species, okay, to at least one antimicrobial drug of 3 or more antimicrobial categories. Okay, so what does it mean? So is a antimicrobial resistance, that means this, due to this property, the microorganism have the ability to resist antimicrobial action, right, by a species of microorganism, let's say E. coli, okay, to at least one microbial drug in 3 or more antimicrobial categories. So antimicrobial category here means, try to remember, in the cell wall synthesis inhibitor video we have discussed that here we are using a category of antimicrobial drugs known as, sorry, not penicillin, it will be, one second, okay, so it will be our beta lactam antibiotic. So I hope you can remember it, right? And another type of drug we have discussed in cell wall synthesis inhibitor was glycopeptides, for example vancomycin, okay. So those glycopeptides and beta lactam antibiotics are the name of antimicrobial categories, okay. And the antibiotics which is under those glycopeptides and beta lactam antibiotics, or let's say other types of we have discussed in various videos, are called antimicrobial drugs, okay. That means antimicrobial categories are the term that is used for the classification of antimicrobial drug, okay. So antimicrobial categories, so each antimicrobial categories consist of different type of antibiotics who have similar mode of action or similar target, okay. Let's say we have categorized penicillin and amoxicillin in the same group. I think you can remember, right? So we have categorized them at the same group because they are both targeting the penicillin binding protein, right? And they both have beta lactam ring. That means their targets are same and their mode of action also same, right? That is why we have categorized in the same group, okay. So that is the idea. So that means the microorganism who have antimicrobial resistance to at least one antimicrobial drug of more than 3 antimicrobial categories are called microorganism who have acquired the multiple drug resistance property, okay. So that means let's say a microorganism X, okay, have developed drug resistance towards penicillin, drug resistance towards vancomycin, okay, and drug resistance towards, let's say, erythromycin, okay. So under such circumstances we can conclude that yes, X is a MDR, that is our multiple drug resistance. Now I hope it is clear to you, right? Because penicillin is from beta lactam, our vancomycin is from glycopeptides, and erythromycin is totally a different one, right? It is from tetracycline, protein synthesis inhibitor, right? So under such circumstances we can conclude that it is a MDR. That means if you want to be a multiple drug resistant bacteria, then you should have antimicrobial resistance to at least one antimicrobial drug of more than 3 antimicrobial categories. Okay, that is the concept. I hope you can understand it now. Okay, so now not only it is a topic of bacteria personally, because MDR, the term MDR you can also use for viruses, you can also use for other parasites, but it is mainly famous for MDR bacteria. Why? Because it is the MDR bacteria are most threatening problem to public health. Okay, because in those MDR bacteria they have developed resistance to most of the antibiotic. Okay, and we have already discussed one of them, right? We have discussed about Staphylococcus aureus, right? So though it is also an example of MDR bacteria. Okay, so it is now clear that we are using MDR bacteria. Okay, that is no problem, but MDR is not confined for only bacteria. Okay, there are also MDR viruses, MDR parasites, right? But the concept is exactly same. MDR virus means those who have developed resistance towards 3 or more antiviral agent, right? That is the idea. So now coming to this part, okay, so scientists thought that yes, we have constructed a new group of bacteria that are multiple drug resistant. Okay, now they also try to, or they are also observing that there are significant difference between different MDRs. Okay, that means the degree of multiple drug resistance varies among different bacteria. What I mean to say, let's say there are total 10 antimicrobial categories. Okay, that can be useful for that particular bacteria X. Okay, and under these 10 microbial categories, there are 5 antimicrobial drugs present in each category. Okay, so now this X, let's say, have developed drug resistance towards 8 of the antimicrobial categories. Okay, and among 8 antimicrobial categories, they have developed antimicrobial resistance towards all the 5. Okay, that means only the category number 9 and category number 10 have the ability to destroy X. Okay, and the rest of the thing are now of no use. Okay, similarly, scientists also find out that there are another bacteria Y. Again, we have 10 antimicrobial categories, and among them there are 5 antimicrobial drugs present in each category. Okay, so now Y have developed antimicrobial resistance again 2 antimicrobial categories. Okay, and all the 5 antimicrobial agent in these 2 antimicrobial categories. Okay, that means the rest of the 8 antimicrobial categories have the ability still to destroy Y. Okay, and similarly, let's say another bacteria Z who have developed antimicrobial resistance to all the 10 antimicrobial categories. Okay, but they have developed resistance to 4 of antimicrobial drugs in each category. Okay, that means in each category there are 1 drug still present that have the ability to destroy Z. Okay, and let's say there are another antimicrobial, there are another microorganism S who have developed antimicrobial resistance towards all the 10 antimicrobial categories, and in those antimicrobial categories all the 5 antimicrobial agent also have developed resistance. Okay, that means S microorganism now cannot be treated with any kind of antimicrobial agents. Okay, so under such circumstances, scientists now decided that yes, we have to further divide MDR into more parts, right, to make it or to make the classification more accurate. Okay, so under such circumstances, they have developed two extra branch of MDR. One is XDR, meaning extremely drug resistant. Another one is PDR, that is pan drug resistant. Okay, so now let's talk about what is extremely drug resistance. So extremely drug resistant is what that I have told you about the Z microorganism. That means extremely drug resistance microorganism have developed resistance to all antimicrobial agent, okay, except two or less antimicrobial categories. Okay, what is the meaning of this? That means, let's say P is the microorganism, so there are 10 antimicrobial categories present, and in each categories there are 5 antimicrobial agents. Okay, so now under such circumstances, P have developed resistance towards 8 antimicrobial categories, and each of the antimicrobial drugs present in that 8 categories. Okay, that means the remaining 2 categories still have the ability to destroy P. Okay, so under such circumstances, you can conclude that yes, P is a example of XDR. Okay, so Mycobacterium tuberculosis have already developed, or there are Mycobacterium tuberculosis strains available. Those are XDR, that is extremely drug resistant. Okay, so along with XDR, there are more several worst situation present that are known as pan drug resistant. Okay, so what is the meaning of the pan drug resistance? Pan drug resistant means those kind of microorganisms who have developed pan drug resistance have antimicrobial resistance towards all the 10 categories, and under those 10 categories towards all the 5 antimicrobial agents. Okay, that means 10 into 5, 50. That means pan drug resistant bacteria have resistance to all the 50 antimicrobial drug present. That means pan drug resistance are almost pan drug resistant microorganism infection are almost incurable, because they have already developed resistance to all the antimicrobial drug present. Okay, so that is why it is often recommended to avoid overuse of antibiotic and to follow strictly the course that is prescribed by a certified medicine practitioners. Okay, so that is why I would also like to recommend you, don't use antibiotic just on the basis of the recommendation of your medical shop. Okay, please go and consult to doctor and then use those antibiotics. Okay, and please follow the schedule as mentioned by the doctor in the prescription. Okay, so that we can prevent the new problem to all the microbiologists and the doctors as well as the scientists named drug resistance. Okay, so now we are going to discuss about some examples of drug resistance. Also, I would like to recommend you that we will not going to discuss about them in details. We will going to discuss about we will going to discuss about XRD, that is our extensively drug resistant, along with NDM1. Okay, and we have also discussed already about MRSA. If you want to know about MRSA, then I would like to recommend you to go and watch my Staphylococcus aureus video lecture series. Then you will surely find a video on MRSA. Okay, so now let's discuss about the examples. So first of all is vancomycin resistant enterococci. We have also discussed about varsa, right? That is vancomycin resistant staphylococcus aureus. You can also watch this. Methicillin resistant staphylococcus aureus, that is our MRSA. Extended spectrum beta lactamase producing gram negative bacteria. Klebsiella pneumonia carbapenem is producing gram negatives. Okay. Multiple drug resistance gram negative rods or multiple drug resistant gram negative bacteria such as Enterobacter species E. coli, Klebsiella pneumonia. Okay. Acinetobacter baumannii along with Pseudomonas aeruginosa and multiple drug resistant tuberculosis. Okay. So that is the first video regarding multiple drug resistance. I hope you have enjoyed the video well and you can understand what I have discussed with you today. So okay friends, bye bye. We will again meet in another video where we will going to discuss about NDM1 and XDR. Okay, so till then friends, bye bye, take care.